thank you for tuning in. My name is Mara Balmer from Niagara IMT, niagaraimt.com. If you find this or any of the videos valuable, please hit the like button and consider subscribing. You can also follow me on any of the social media or contact me to sign up for our newsletter. I'd also like to give a shout out to the IMT Wellness Center out of West Hartford, Connecticut, IMT Community on Facebook, and Manual Therapy Seminars at manualtherapyseminars.com. They all have great tutorials, in-person and online classes. But for this video, I'm going to explain exactly what Integrative Manual Therapy is and how it can be of help for you. So let's get into it. Today I'll be explaining about Integrative Manual Therapy, IMT, and how it can be of help to you. IMT is a wonderful compilation of various healing modalities originally developed by Dr. Sharon Weiselfish G. Mateo in the mid to late 20th century, but it's still being developed today. IMT stems from physical therapy, osteopathy, Chinese medicine, homeopathy, nutritional counseling, energy medicine with exercise, movement, and guidance. By definition, Integrative Manual Therapy, IMT, is a hands-on healing tool. It is very gentle, non-invasive, and people are fully clothed during a treatment session. Therapists place their hands on the body and utilizing the skill set, we can access and uncover strain patterns in the body. It's an entire toolbox full of assessment and treatment techniques that look at all systems in the body and not just the musculoskeletal system, which are muscles and bones. But IMT looks at the circulation, the nervous tissue, the lymphatic tissue, the endocrine system, men's and women's health, all of which, plus others, might be contributing to somebody's dysfunction or disability. Hands are moving and assessing different systems in the body, but what it also does is it looks very closely at the history of a person. Maybe a history of trauma, maybe medications, maybe current lifestyles. There might be allergic responses to their diet that they might not even know about. There might also be exercises which are given, but it's like the right tool at the right time. So it's the correct exercise for that person at that moment so that what they do is not further exacerbating their pain. So let's take an example, like let's say a frozen shoulder. Compared to physical therapy, PT generally looks at the shoulder and they might give some exercises and mobility techniques to help try and mobilize and strengthen that shoulder. And it might work, it might not work, or it might not have lasting results, or it can be very painful. So what IMT looks for is a deeper concept of what we call a protective mode. And a protective mode is the body utilizing its wisdom, its innate wisdom, and its hierarchy to protect things that are more important than perhaps the shoulder. A protective mode might be that a person had some kind of trauma to their rib cage, to their lungs, to their heart during an earlier accident. And because the body is looking to protect that area and limit the movement, it might freeze down the shoulder in order to protect the heart and the lungs, because the heart and the lungs are surely more important and vital to our life than the shoulder might be. So trying to mobilize a shoulder that is really in a protective mode is not going to be sustainable. So IMT does look at the different strain patterns and the rhythms in the body. A rhythm that everybody is familiar with is your pulse. If you put your hands here at your wrist, you can feel your pulse, but it doesn't mean you're feeling your heart. But it is an indication of what the heart is doing, the vitality, the frequency, the volume. But there are hundreds of other rhythms in the body, and IMT, with its tools, are able to assess the overall vitality of those other systems, looking at drainage, looking at circulation, looking at nerve pathways, so on and so forth. Now, a person might say, how can you put your hands on somebody and be able to assess a rhythm or a vitality of a structure? And I'll give you an analogy to that. I have a girlfriend of mine who's a sommelier. That's a wine connoisseur. A wine connoisseur or a sommelier could pick up a glass of wine, take a sip, and tell you what year it's from, where it comes from, what type of grapes, the type of weather that it was grown in, and the type of soil that it was grown in. But somebody who's learned and has acquired the skill can tell you more about something than possibly I can. Energy medicine is also a wonderful practice. IMT prides itself on understanding the pathoanatomy and physiology, the science of it, while combining the art of energy medicine. With energy work, we might work with the body in a very global sense. How can we relate to ourselves? How can we relate to our immediate surroundings? How can we relate to our community? It's really a micro to macro development. But you need to understand the structure, because once you can heal the structure, the function improves all on its own. I'll give you another example. It's like a piano. You can have a concert pianist who comes in to play beautiful music, but if the piano is not tuned, nothing's going to sound good. IMT sort of has a way of not only being the pianist, but also being the piano tuner. Well, the body works in the same way. We need to fix the structure before the systems can work properly. We can sense, as an IMT therapist, the energetics and work in conjunction with the biomechanics. IMT focusing on the specificity, let's say in this case of the heart, I might need to know the differentiation between what is the tricuspid valve doing compared to the mitral valve. IMT addresses all sorts of sources of dysfunction, be that spiritual, mental, emotional. For example, a person may have been disenfranchised by the medical community with pain in the shoulder or the knee or the neck or the lower back, and gone to their doctor and had an ultrasound, an x-ray, an MRI, and been told there's nothing wrong. It can give you a sense of hopelessness. But what about other emotional issues? Grief, loss, despair, anxiety, depression, distrust, trauma history that is not a car accident, but more emotional, sexual, PTSD, developmental disorders, addiction, overwhelming stress. All of these can then lead into paranoia, personality disorders, OCD, bipolar issues. The list goes on and on. It still involves the work of IMT, because IMT works with the emotional center in the brain, which is the limbic system. The limbic system in conjunction with the frontal cortex. The frontal cortex is responsible for creativity, but more executive decision-making. And the limbic system is our emotional control center, but it's also set up for our survival mode. It facilitates the sympathetic nervous system, which is our fight or flight response. The limbic system can also go into a lockdown or a protective mode. And there are neurological components to all of these. To be clear, I'm not a psychiatrist or a psychologist. And there are plenty of severe cases that need more intervention from the medical community. But there are common pathways that become disrupted and dysfunctional, which can be addressed with IMT. Other neurological conditions that IMT works with are stroke, Parkinson's, muscular dystrophy, MS, dementia. IMT will always help your body to try and right itself and find better homeostasis, because ultimately the feeling of health and wellness is like nothing in this world. Integrative Manual Therapy, at its core, will help you to look better, to move better, and to feel better for good. Thank you so much for tuning in. It was truly my pleasure to be here and explain a little bit more about Integrative Manual Therapy with you. And I hope you connect with me soon. through all of the social media, and don't forget to hit the like button or subscribe to our video series. Thank you again.